Friday, everyone. You are taking a... Welcome back, everyone. J-Lo and Kim Kardashian, two fashionistas blessed with a nice butt. But if you aren't born with it, there's always the Brazilian butt lift. And only a few surgeons perform this procedure, including our next guest, board-certified plastic surgeon, Dr. Lane Smith.
And he's here to tell us what every patient should know before they choose a doctor. Doctor, thank you so much for being here.
Thank you for having me, Sean.
So people think of this as a lighthearted type of thing, but this is actually a serious procedure. And actually, a woman actually recently died from a botched buttocks enhancement surgery. Tell me what was behind that.
Yeah, that's correct. You know, we've talked on this show before, and if people would watch this show more, they would already know this, so we'll remind them that if you're going to have any type of plastic surgery done, you need to go to a reputable physician who is board certified. And there was a woman here in Las Vegas just a couple weeks ago trying to, circumvent that. In the back room, was getting silicone injections into her buttocks and died. The people doing it were not licensed physicians in Nevada or in America. They were from Colombia, and they were doing something illegal, silicone injections, and indeed someone died. So always, any type of plastic surgery, please, first of all, stay in America. We have the best plastic surgeons in the world here. And secondly, go to someone who is reputable and board certified.
And getting a procedure done in our backyard is good because you can also do follow-up. You don't have to fly somewhere, and some people aren't going to do that, so that's
always very important.
And not only are you board certified, you're actually quadrupled board certified. What does that mean?
Well, it just means that I've done some a little extra training, yeah.
Yeah, so you got to definitely do your homework.
There are a lot of options available for people who are looking for this type of enhancement. What are those options?
Well, I mean, there are two main options. You can have silicone butt implants, which is different than direct silicone injection. That's actually very safe. Or you can move your fat around. You can take fat from one area and put it in your butt. And that works very well, too.
And that's a double whammy because you get rid of the fat.
Well, that's exactly right. So when patients come in, I say, hey, look, the advantage is, you can get better. And we usually have to take it from many areas.
Yeah.
So we'll take it from the waist and from the tummy and arms or legs and then, put it in their bottom. And so they get improvement in many areas.
It's 2 for 1.
Obviously, you're an expert in this area, and you also have some props to show us.
Yeah, sure.
Can we kind of go over this and tell us what we're looking at?
Yeah, these are some silicone buttock or butt implants. This is the one I like the most. It's soft and pliable, a little more firm than a breast because the bottom should be more firm than a breast. But the important thing is, this is FDA approved for use as an implant, and these are very safe. They cannot leak. That's another important thing. Here's one that's been cut. You can see
it's solid.
Yeah, it's soft, but it's
gel. Yeah.
Yes, it's not going to leak. And this is completely different than the direct silicone injections, which can be very dangerous. They can be lethal, as we know with this lady, or eventually they will. If some people get them and do fine with them, a lot of strippers do it. They shouldn't do it. They go to other countries, do it, and then they're fine for a little while, but slowly those direct silicone injections will get spit out by the body. The body will eventually extrude them, and it will be really, really bad.
Yeah. Well, what's the recovery time for something like this?
Well, for a routine buttock augmentation, you need to go back to work in a week.
Wow.
It's not super hard on you. It's kind of like breast implants. Dow said this earlier. Kind of like breast implants for your butt.
Yeah, right.
It's that simple. If you break it down that way.
Are you seeing an increase with people that want the buttock transplant?
Absolutely. I mean, that's just skyrocketing, actually.
Obviously, there's different sizes. So if you want something that's just a little bit, or you want to go a little more dramatic, you can do that.
Yeah. There are many sizes. In Vegas, honestly, most often we're doing the largest to next to largest. It's the big sizes that people are wanting these days.
This is Vegas.
This is Vegas, exactly.
Tell me about your experiences with patients that are coming in and the results they've had.
Oh, they love it. I guess if you get on my website, you can see some before and after pictures. But patients just love it, and I love it because they love it. So it's one of my most favorite procedures to do. I think yesterday alone we had 4 or 5 people in my office, for consultation regarding buttock enlargement.
Obviously, that's just one procedure you do. You do so many more. You do also for the face.
Sure.
Botox, a very common procedure for you. That's
all those kind of things. Yeah.
What other things do you do?
Well, I mean, I do mostly cosmetic surgery at this point in my practice, and there are about 15 things that I do really commonly. From breast augmentation, rhinoplasty, most commonly breast augmentation. Next most commonly rhinoplasty, and then probably third would be the buttock things, tummy tucks and things. We've talked
the
about
mommy
some
tucks
of those.
that we've talked about. Yes.
Yeah, absolutely.
And you know what? Just for a moment, I'd like to applaud ourselves. We have not mentioned Sir Mix-a-Lot once in the segment.
yeah.
Until just now. Until just now. He just brought it down for us.
Well, thank you
so
guys.
much, Dr. Smith. For more information on the Brazilian butt lift or other procedures Dr. Lane Smith can perform, go to smithsurgery.com or call the number you see right there on your screen. Next in the Morning Blend, the latest